The surgery is over, you're in recovery, and you think the dangerous part is done, but surgeons know that what happens in the next 72 hours can be just as deadly as what happened in the operating room. Let's start with the biggest fear: bleeding. During surgery, the surgeon controlled every blood vessel, cauterized or tied off anything that could bleed, but after surgery, things can go wrong. Blood pressure rises as you wake up, and a vessel that seemed secure starts oozing. A ligature slips. A cauterized artery reopens. Internal bleeding after surgery is terrifying because you can't see it happening. The patient looks fine, then suddenly their blood pressure drops, their heart rate spikes, and they're bleeding out internally. Surgeons check your drain output obsessively. Those tubes coming out of surgical sites aren't just for show. They're monitoring how much you're bleeding internally. Here's what makes post-op bleeding worse. Patients are often on blood thinners. The surgeon has to balance the risk of surgical bleeding against the risk of blood clots. Stop the blood thinners too long, and the patient has a stroke. Restart them too soon, and they bleed into their surgical site. Now let's talk about infection, because it's every surgeon's nightmare. You can do a perfect operation in a sterile environment, and the patient still gets infected. Bacteria live on your skin, in your gut, in the air. The moment the surgeon cuts you open, there's infection risk. Post-operative infections can happen days or even weeks after surgery. The surgical site gets red, swollen, hot, painful. In the worst cases, the infection spreads to the bloodstream, sepsis, and the patient can die from an operation that was technically perfect. Surgeons prescribe antibiotics before surgery, maintain strict sterile technique, and monitor for infection. But some infections are inevitable. Surgeries involving the bowel are especially risky because gut bacteria can contaminate the surgical field. If you're learning what really happens after surgery, hit subscribe. We're exposing the post-op complications that surgeons lose sleep over. Here's something most patients don't know: blood clots. After surgery, you're lying in bed not moving much, and your blood flow slows down. Clots can form in your legs, deep vein thrombosis. If that clot breaks loose and travels to your lungs, it's a pulmonary embolism, and it can kill you in minutes. This is why nurses bug you constantly to move, walk, do leg exercises, wear compression devices. Surgeons know that pulmonary embolism is one of the leading causes of post-operative death, especially after orthopedic surgeries. That's why they put patients on blood thinners after surgery, even though it increases bleeding risk. Let's talk about wound dehiscence, the surgical incision splitting open. The surgeon closed you in layers: muscle, fascia, skin. But if those layers don't heal properly, they can separate. Maybe you cough too hard, maybe you have diabetes and heal poorly, maybe you're obese and there's too much tension on the incision. In abdominal surgery, this is catastrophic. Your intestines can push through the opening. Evisceration. Here's something surgeons worry about that patients never consider: anastomotic leak. When surgeons remove part of your bowel and reconnect the ends, that connection has to heal. But if it doesn't heal properly, it leaks. Bowel contents spill into your abdomen. You develop peritonitis, inflammation and infection of the abdominal cavity. This is life-threatening. Anastomotic leaks have mortality rates of 10 to 30% depending on severity. Surgeons check for this obsessively in the first week after bowel surgery. Any sign of abdominal pain, fever, elevated white blood cell count gets investigated immediately. Now let's talk about anesthesia complications. You're awake, but the drugs are still in your system. Some patients have prolonged sedation, others have respiratory depression. The anesthesia suppressed their drive to breathe. Elderly patients often develop post-operative delirium, becoming confused and disoriented for days. Here's one that surprises people: cardiac complications. The stress of surgery puts massive strain on your heart. Patients with underlying heart disease can have heart attacks after surgery, even though the surgery had nothing to do with their heart. The anesthesia, blood loss, pain, inflammation, all of it stresses the cardiovascular system. Let's talk about pneumonia, because it's one of the most common post-op complications. After surgery, especially chest or abdominal surgery, it hurts to breathe deeply. Patients take shallow breaths. Secretions build up in the lungs. Pneumonia develops. This is why nurses push incentive spirometers, those breathing devices that make you take deep breaths. Here's something dark. Patients can die from complications that have nothing to do with the surgery itself. You have successful gallbladder surgery, but then you develop a UTI from the catheter, which spreads to your bloodstream. Or you have a knee replacement, develop pneumonia, and die from respiratory failure. If this is opening your eyes to post-operative reality, make sure you're subscribed. We're breaking down the medical truths that could save your life. Let's talk about pain management. Inadequate pain control keeps patients from moving, breathing deeply, and recovering properly. But too much pain medication, especially opioids, causes respiratory depression, constipation, and addiction risk. Surgeons are constantly balancing effective pain relief against dangerous side effects. Here's what they worry about: opioid-induced respiratory depression. The patient's in pain, gets more morphine, falls asleep, stops breathing adequately, oxygen levels drop, brain damage, or death occurs. Now here's something surgeons worry about but rarely discuss: patients not following post-op instructions. They tell you don't lift anything heavy. You lift something heavy and cause a hernia. They tell you don't smoke. You smoke and impair wound healing. Surgeons can do everything right, but if patients don't follow instructions, complications happen. Let's talk about the psychological burden on surgeons. They did your operation, you developed a complication, and now they're wondering what they could have done differently. Even when complications are unavoidable, surgeons second-guess themselves. Here's what happens when things go really wrong. The patient goes back to the OR. Maybe for bleeding, maybe for infection, maybe for bowel obstruction. Every return to surgery increases risk. The patient's weaker, the anatomy's distorted, adhesions have formed. Surgeons also worry about long-term complications. The surgery was successful, but 6 months later, the patient develops chronic pain, or they develop adhesions that cause bowel obstructions years later, or they have nerve damage that never fully recovers. Here's the reality: surgery is controlled trauma. You're cutting into someone, rearranging their anatomy, and hoping their body heals correctly. Most of the time it works, but surgeons know that even perfect technique can't prevent every complication. What surgeons worry about after the operation is everything. They worry about bleeding, infection, clots, heart attacks, pneumonia, wound breakdown, and 100 other things that can go wrong. They check labs, review imaging, examine incisions, and monitor vital signs obsessively because surgery isn't over when they close the incision. Next time you have surgery and wonder why they're checking on you constantly, drawing blood, making you walk, bugging you about breathing exercises, it's because your surgeon is worried. Not because they did anything wrong, but because keeping you alive and healthy after surgery requires vigilance every single day until you're fully recovered.